So big changes over the past few weeks. We thought this would be a good time to check in with the doctor. And so we're joined by infectious diseases specialist, Dr. Zain Chagla, who is in Mississauga. So Alberta and Saskatchewan lifting public health restrictions this week. Ontario is set to do the same soon. There is this pressure, to get back to normal. Is it too early?
Look, Omicron is going to be here forever. And I think we have to accept that, and we have to figure out a way to live with it. We do see in this wave, globally, cases are coming down, not only in Canada where restrictions were imposed, but places like Israel and Australia where there were very soft restrictions imposed as well. And so I think we are through the worst of this and what would be normally as a part of this pandemic. And again, the focus needs to be getting back to normal rather than necessarily using restrictions to get through this pandemic.
So the protesters, as we know, are calling for an end to mandates and vaccine passports. What about those tools in particular? Are they still effective at this point?
Look, first and foremost, we are one of the most vaccinated countries on earth with over nearly 90% of people that have received 2 doses of vaccine in the adult world. The fact that Omicron likely takes the efficacy down of 2 vaccines to nearly zero. Third doses do help, but they're not perfect, and there is a time-based waning there. A lot of people were recently infected, and it's not reasonable to expect people to get a third dose for these mandates. It's probably time to start thinking about taking them down. And again, recognizing that people do need to get vaccinated, but for their own personal protection, rather than necessarily this type of mandate-based system.
We have about a minute left, and with some trepidation, I ask you this question. So much of our conversation is informed by Omicron. Could there be another wave coming, and could that wave be worse?
Look, we don't know what happens with variants. Our roles in global health equity for vaccination are still important to help prevent variants from coming, as we saw Omicron essentially change things in a month overnight. We don't know what the future brings, but we do need public health trust, and we do need the population to feel like they have their lives back when we have good times. And so that's part of our lives moving forward.
And we need to get as many people around the world vaccinated as possible, I suppose. Dr. Chagla, thank you very much.
No problem. All the best.